you a mouth breather? Well, a lot of people are claiming that mouth breathing can result in changes like this: a small jaw, a crooked nose, a smaller airway, versus up here, a strong jaw, a more straight septum and straighter nose, and more open airways. So stay tuned to the very end of this video so I can tell you about this medical tape and what I do every night to stop myself from mouth breathing. So the answer is not so simple. Mouth breathing can contribute to a smaller jaw, but there's a lot of other things like chewing hard food and breastfeeding that can contribute to jaw structure. There's a book by James Nestor called Breath. This is a must-read for everyone. It talks about the benefits of nasal breathing, jaw structure development. A lot of that happens when we're young, and when we get older, it's actually harder to change, but it is still possible. So now I'm going to tell you about my little trick.
So it's back to one of the popular videos that we have discussed before, and yes, it's absolutely correct. Most of everything he said is correct. Of course, during our growth and development, we have the growth wave that we can catch, and we can early on can get involved and affect some of these things. We can move the direction of growth in the right ways. Breastfeeding is central importance when the baby is born, because the movement in breastfeeding is completely different than sucking from a nipple. Breastfeeding is a movement of the lower jaw forward and backward, which actually helps develop our temporal fossa and the head of the condyle, whereas sucking on a nipple does not do that. What it does strengthen the lips and cheeks, and actually that narrows everything down. Exactly the opposite effect of what we want. It also teaches the child the wrong tongue posture, which is on the floor of the mouth rather than the palate. So all in all, it is. The correct thing is that in our later years, we're not talking about growth. What we have to understand, we're talking about remodeling, and remodeling is scientifically proven continues in our life all the way up into our mid-70s. So you can still affect the structure of bone throughout your life with proper exercise, by challenging your bone. And these are scientifically proven. You can look at the works of Dr. Julius Wolff back in 1892, published a series on the law of transformation of bone, which basically tells that the bone forms or deforms under pressure or under stretch. Another one from a dental standpoint, Dr. Melvin Moss, a great clinician, back in 1962, put the bone matrix theory. And basically he said that the shape of the bone follows, or rather the growth does not depend so much on bone or cartilage, rather the soft tissue. So like any other pioneer, he was ridiculed, but he went back literally 30 years of practice and collecting data, and came back in 1992, republished his work with tons of clinical data showing that it's the soft tissue that gives the direction of growth to the bone and cartilage.